We will have a number of short, sharp presentations from a variety of speakers on significant and serendipitous findings from the research into medication safety in paediatrics. We have a number of short presentations, so it'll be fast. You'll have a chance to get some condensed knowledge delivered to you. Our first speaker is Dr. Karla Seaman. And Dr. Seaman is an experienced pharmacist and health service research fellow in the aged care evaluation and research team at the Australian Institute of Health Innovation. And she will be speaking to us today about paracetamol errors in paediatrics. Over to you, Karla.
Okay. I think I'm doing something wrong too now. Okay, no, all good. All right, so we're going to dive into paracetamol this afternoon just really briefly and sort of give an overview of what we've talked about this morning, but in relation to paracetamol prescribing and administration. As we know, this is really commonly used, and when used at the correct dose, frequency and duration, we know that it is safe. However, there is also error for harm in relation to paracetamol, including acute liver failure. And there's limited consistency in the literature on prescribing rate, which ranges between 1 to 13% of prescriptions found to have at least one error. And there's also only one study that's ever been done on administration errors for paracetamol, which had an error rate of 5 per 100 administrations. So we aim to look at the incident type and potential harm and the characteristics of paracetamol prescribing. And to do that, we to pull the paracetamol orders out, we used the ATC code, and for clinical prescribing errors, we looked at paper versus the 1 year post-EMM period. But for the clinical administration errors, as we've heard earlier today, there was no difference between the two phases, so we've just combined them together to explore paracetamol in more depth. So there were 3,397 paracetamol orders, of which 390 had a prescribing error. And if we look at this per 100 orders, in the papers this was 11.85, and 1 year post-EMM this decreased to 11. There were 81 prescribing errors with serious potential harm, and this was 2.78 per 100 orders in the paper chart, and this decreased to 1.9 in the 1 year post-EMM period. When we look at age group, it sort of shows quite a different factor, that those under the age of 1 month had a really high risk of clinical errors per 100 orders, which then dropped and then slowly increased with age. And we saw that for both the paper and the 1 year EMM period. And then when we look at clinical errors with serious potential harm per 100 orders, again in the paper period, there was quite a higher rate of serious harm errors, but then throughout the age groups it was kind of a little bit more horizontal there. Sorry, I think I got my slides mixed up then. So looking at results by error type, wrong dose was the most common error, with paper having 8.9 clinical errors per 100 orders, which decreased to 7.87 in the 1 year post-EMM period. And very similar to what we've seen also today is that duplicate drug therapy remained constant across the paper period and the 1 year post-EMM period. When we dive down into a little bit deeper into the wrong dose errors with serious potential harm, there was 26 wrong dose errors, of which 22 were overdose, and they were all as a result of adjuster failure for overweight children, and 4 were underdosed due to typographical errors. However, we did see that both those type of wrong doses decrease during the paper and 1 year post-EMM period. Now moving on to administration errors. So there was 797 administrations observed, and there was 124 administrations with at least one error for paracetamol. And this had a percentage of about 16% with at least one error, and there was 47 administrations with at least one area with serious potential harm. And this was about 6% of all paracetamol administrations. Again, if we look at this by year, there is a slow trend in relation to administration errors increasing as children do get older. And if we look at the error roots and the cause of the errors, we've got wrong dose as the highest percentage of errors, representing about 6%. Though when we look at IV routes, of the IV routes, 95% infusion rates had an error, and of which 7% was an error with serious potential harm. So just key points. I know this is a really brief overview of paracetamol, but paracetamol prescribing errors are common, and particularly for newborns in that adolescent period. And this really centred around the weight dose adjustment. Prescribing duplicate drug therapy still remained an area of concern with EMM prescribing, and similar to the patterns of all medications post-EMM. Paracetamol administration errors are commonly associated with wrong dose, and this increase with age could be due to the rounding off to the 500 milligrams to take a tablet. Administering paracetamol IV should be done with caution, and nearly all paracetamol IV infusions had an administration error, and almost 1 in 10 had an error with serious potential harm. So they're the key primary take-home messages for paracetamol. Thank you.